sir. Ma'am, with your permission, we would like to start. Thank you so much for it. So, ladies and gentlemen, are we ready? Oh, I just heard it from Dr. Rajesh. Are we ready? Yes. No. Yeah, are we ready? Yes. Thank you so much. Good evening, ladies and gentlemen. Once again, my name is Chintamani Chitale from Mankind Pharma, and I welcome you all to this red-lettered day in the history of pharma industry, where a real-life hero meets real, where the science meets art. All occasions begin with auspicious lamp lighting, but today, there is something which is more auspicious than lamp lighting, to honor the memory of a mother. Srimati Kusum Malhotra, mother of Dr. Rajesh Malhotra, left her heavenly abode on 29th April this year. May I request all the dignitaries who can stand to please stand up and observe a moment of silence as a tribute to her. Thank you so much. Thank you so much. A huge round of applause again for Srimati Kusum Malhotra for leading such an inspiring life and for giving the world a legend, Dr. Rajesh Malhotra. A huge round of applause, please. And now we move to lamp lighting. May I now invite Dr. Rajesh Malhotra, sir, Dr. Ruchi, Mr. Rakesh and Ms. Meenakshi Malhotra, Dr. Sanjay and Dr. Anjana Khetrapal, Mr. Vikas Juneja and Mrs. Madhu, Mr. Shiv, Thank you so much for that. So yesterday when we were speaking, you asked that, why a documentary on you. So our promoter, vice chairman and MD, Mr. Rajiv Juneja, articulated it very beautifully, that why do we need to recognize the legends and the legend like you that you are. Can we please play Rajiv sir's message?
Good morning, Namaskar, sir. My name is Rajiv Juneja. Thank you very much for coming in this function. I represent Mankind as Managing Director and Vice Chairman. From core of my heart, I say thank you very much for sparing so many days for Team Mankind. in creating this film of yours. And there's a purpose for creating this film. There is an incident involved with this. Many years back, some very famous scientists came to our hometown, and I wanted my son to join me in the function. But he said he did not want to join because, as per him, function would be boring. The same way my son wanted to go to a function with me in which a film star was coming and a cricketer was coming. Image of a great professional, a scientist, was different than the image of a cricketer. So that particular day, this idea came that we should do something which can really create a bigger image, better image. What these scientists, these great people, in our case, great doctors, master of the craft, they have done something great for the service of humankind, for medical science, for the patients, for society as a whole. So keeping that in mind, we try to build something on that. We hired the services of best of the professionals and tried our level best to make it world class. And hope that you would like it, your family would like it, your friends will like it. That's our endeavor. In Mankind, on one side, sir, we always want to promote very aggressively the science side, the medical science to doctors. And we just want that whatever latest things are happening in the field of medical science, that should be propagated. At the same time, because our name is Mankind, company's name is Mankind, we cannot forget the human side. The kindness is always there. So we always believe that whatever a personality becomes, whatever you have become, there must be so much of contribution of your whole family. Your parents, your wife, your kids, your teachers, your colleagues, they too must have contributed. Your friends must have contributed a lot. So with this film, the help of this film, we have tried to create some kind of a memory in which we could really showcase you as a hero, which you actually are. We don't know, how much we have succeeded, but we always believe in karma. We have tried our level best. Team Mankind have done the best possible thing. Their intentions were great. Their trying were the highest level, and hope that you like it. So thank you so much, sir, for coming here. Thank you to your whole family. Thank you to the friends. Thank you to the doctors for coming here. We are just grateful and hope that you will like the film, you like the hospitality of Team Mankind. Thank you so much and have a great year ahead, sir. Thank you very much.
And now for the main event, we are just few moments away from the documentary. I hope you enjoy watching the documentary as much as we enjoyed making it. Can we please play the documentary now?
जनवरी 2001 को मुझे फ़ोन आया मेरे हेड ऑफ द डिपार्टमेंट का। उन्होंने कहा कि आपको कल सुबह भुज जाना है।
स्कूलों ने ये कहा कि साहब यहाँ अगर ये टीम नहीं आई होती दिल्ली से तो हमारे बच्चे ये आज बचते नहीं। एक डॉक्टर मल्होत्रा की टीम है जो दूर दूर तक गई हुई है।
I had to operate lying on my tummy because the working space was just over 1 foot. She had lost far too much of blood and eventually after a couple of hours she died. We couldn't save her.
When he came back, I think he was also quite devastated after looking at whatever happened there.
You have to do things for others before you do anything for yourself. So I always say that if you're not committed, you should not take medicine. If you want to make too much of money, don't take medicine. You should become a doctor because you love doing medicine and love treating people.
He says, I'm very thankful. I could have been born as a laborer. I'm very thankful for this life which I am having.
Because you love the Supreme Lord, you also serve society. And that I could see in Dr. Malhotra because he goes beyond the call of duty.
A real Shravan Kumar of the modern time.
He doesn't just cure, he makes you happy.
We owe it to the future generations to teach them well. Don't hold back anything.
I saw Professor Malhotra operate and I thought, yes, this is the man I would like to be like.
There is a Vivekananda in everyone. So if I have to find my Vivekananda, then he is my Ramakrishna.
एक निष्ठावान प्राणवान ऐसा चिकित्सक है डॉक्टर राजेश मल्होत्रा.
Ladies and gentlemen, please give it up for Dr. Rajesh Malhotra. Can we have a standing ovation for him, please? Thank you everyone. Ooh. Goosebumps, sir, goosebumps. The very thought of, sir, not treating a patient, not helping a patient, but to serve a patient, I think it's a true mark of a legend, sir. So if I may now invite you on the dais, and if I may invite the leadership team of Mankind, Dr. Sanjay Kaul, Mr. Sudipto Roy, Mr. Prince, and Mr. Anand Sagar on the dais to felicitate, sir, please. तालियां बजती रहें, please. Sir, may I request you to stay on stage for a minute, and may I request my colleagues to just take the seat. Thank you so much. May I now invite upon dais Dr. Ruchi Malhotra, Dr. Ashna, and Mr. Vrishank on dais now, please. So we would like to and can we have Mr. Sarang Juneja on the dais as well, please? So we would like you to felicitate your family for the support that they extended to you. So please, if you may. And can you please have the bouquet? A huge round of applause, ladies and gentlemen. Thank you so much. Ma'am, sir, you can please take your seats. I'll just need you for one more moment. May I now invite upon the dais the Mankind team. So without their support, we couldn't have made this documentary. So can we just quickly have the Neo Mankind team on the dais, please? All the colleagues, all of you deserve a huge round of applause. Thank you for making this possible. Thank you everyone. And sir, you also now please may take your seat. Thank you so much, sir. Thank you everyone. I think all of us are here because we have a very special place for sir in our hearts. So to express your feeling for sir, may I now invite upon the dais Mr. Shiv Kumar sir, MD Apollo Indraprasth Hospital. A huge round of applause, ladies and gentlemen. And if we can have the hand mic, please. Good evening, sir. Yes, sir, so that all of us can see you. Over to you, sir.
Thanks, Chintamani. Good evening, everyone. It's truly an honor to stand here tonight at the grand premiere of a documentary celebrating the incredible journey of Dr. Rajesh Malhotra in the White Coat Legends series. This film is a tribute to his visionary contributions, relentless dedication, and lifelong commitment to the science of orthopedics and the medical excellence. Dr. Malhotra's achievements remind us of the profound impact one individual can have in shaping the future of healthcare and inspiring generations of medical students. His journey is not just a story, it's a legacy of innovation, compassion, and determination. A big thanks to Mankind team and also the Docflix team for putting together this inspiring documentary, giving us an opportunity to honor an extraordinary individual. Let us enjoy this evening of inspiration and excellence. Thank you, Dr. Malhotra.
Thank you so much, sir. Thank you. May I now invite Dr. Neerja Batla. Good evening, ma'am. Nice to have you again. Welcome. All yours, ma'am.
Thank you. Again, he meant I was here last evening for Dr. Kriplani's Legends program and back again today. Good evening, ladies and gentlemen, friends, colleagues. It's such a pleasure to see one's friends being honored and truly also insightful sometimes to learn some things which you never knew or you forgot. I think it was a beautiful film and really recaptured everything. And I don't know where to exactly start. It's been a long association with Rajesh. We've both been MBBS students at AIIMS, and we've watched him grow and progress. Ruchi has been a dear friend. And I think, in a way, I might actually say, you know, there's this position called honorary gynecologist to the president or vice president. So I was served as the honorary gynecologist for 2 terms to the vice president. I think I served lifelong as honorary gynecologist to Rajesh's family. So I've been knowing all of them, his brother's family, his sisters, his mom, very special memories, and how caring she was. And she would bring people who were not affording, whom she met through her spiritual connections, and ask me to help them. So it's been really wonderful to see the attitude of service and caring and sharing that they bring. But of course, Rajesh has been honorary orthopedician to my family, and he has taken great care of my parents and myself personally as well. So it's really been a two-way street in that respect. And I think we just love him for not just his competence, which is undoubted, but for his wit. And the patient waits for him to come and cheer him or her by his wonderful comments, his wonderful happy aura. And Rajesh is so proud of you, really wonderful to see, and wish you all the best, and may you have many more laurels, and may the Lord help you to help others as you have been doing.
Thank you so much, ma'am. Thank you. Now I'm very tempted to call Rajat Sharma sir on the dais. So if it's okay with you and if you can speak a few words about Dr. Rajesh Malhotra. Sorry, sir, we don't have the Adalat setup, but all yours, sir. Over to you, sir.
एक्चुअली मुझे बिल्कुल पता नहीं था कि यहाँ बोलना भी पड़ेगा. अगर ये फिल्म मैं नहीं देखता तो मुझे लगता कि डॉक्टर मल्होत्रा को अपने नाम के काम के लिए ये बड़ा जरूरी चाहिए कि लोगों के घुटने खराब हो, लोगों के हिप खराब हो, लोगों की हड्डियां टूटती रहें. आज पहली बार उनकी बात सुन के मुझे पता चला कि वो लोगों को सिखाते हैं कि हम नहीं चाहते आप इस सिचुएशन में पहुंचे. लेकिन दो बात मैं उनके बारे में कहना चाहता हूं. एज ए डॉक्टर तो आप सब लोग जानते हैं, एज ए ह्यूमन बीइंग, इंसान के तौर पे एक ऐसा डॉक्टर जो अपनी बात से आपका आधा दर्द दूर कर दे और अपने इलाज से आपका बाकी बचाव दूर कर दे, ये डॉक्टर राजेश मल्होत्रा हैं. थैंक यू वेरी मच.
Thank you so much, sir. Thank you so much. Dr. Vineet Ahuja. So he's here, he's here. Good evening, sir. All yours.
Well, he has been truly inspirational. You have seen that. Like when it comes to his commitment, you have seen that. But we have been very lucky that in the sense that we have seen it at a very, very personal level. And एक जैसे छोटी सी बात है कि अब जैसे मेरे घर में सारे लोग हैं, मेरे पेरेंट्स, मेरी वाइफ, मेरे सिस्टर इन लॉ, सारे सर के पास जाते हैं. और सारे सर के पास जाते हैं और फिर आके शाम को बोलते हैं, बड़े खुश आते हैं. फिर कहते हैं उसका जाके कहते हैं, यार तू ऐसे हंसाता क्यों नहीं है यार. वो तो हमें ठीक भी कर देते और हंसाते भी है. तो अगली बार मैं डरता हूँ उनको भेजने के लिए. He has had a magnetic pull over the patients. And more than that, his spiritual commitment, जो इतना ज़्यादा शायद सर ने नहीं बताया इसमें. But we have seen that every year he goes to Indore, Ujjain. And apart from that, in the morning he would go to Chhatapur Mandir. Every year in March, every year in April. And सुबह सुबह पूरा तिलक लगा के आएंगे वहाँ से. And this inspiration is something which we are going to miss at AIIMS. And we wish him lots of luck. We wish God bless him. And we are really missing you, sir. Thank you so much.
Thank you so much, sir, for such warm words. May I now have Dr. Amit Latwal on the dais, please? Dr. Amit Latwal. Hello, sir. Good evening. All yours, sir.
Good evening, everyone. So I had the opportunity to work as an administrator with Sir. When he was the chief, I was the additional MS of Trauma Center. So Sir has, everyone knows Sir as a very good clinician, but I have seen him as an excellent administrator. So there are some qualities which have to be in you. And most important was he was able to pick up a very good team. Healthcare, as you know, it cannot be given by a single individual. So to improve the things, you need to put in place a very good team. And I had never met him before he chose me as an additional MS. So, but he was able to figure out that I am the right person for that job. And I had never worked as an administrator before. So in that sense, he was able to put in a very good team. And that team delivered, and he was also able to improve the systems. System improvement is very, very important. And that I saw how he was able to do it. The resources which were not in use, he was able to put them in full use for the patients. Even without getting the resources from the government. We were not able to get the manpower sanctioned, but due to his efforts, we were able to start 4 new wards. We were able to start the office block. So that was amazing thing. Despite the fact we had a very powerful nursing union, we were able to take them along and we were able to utilize the resources. So that is how, with the existing or minimal resources, he was able to put in a good utilization of the resources. Then in crisis management also he is terrible. We had COVID and we were suddenly told to convert trauma center into a COVID hospital, and within 8-9 days we were able to convert that existing trauma center to a COVID hospital and able to shift the trauma center to the main hospital. And personally, I have also grown in my experience with him. As an administrator, our perspective is quite different. And by working with him, I came to know that quality of care, empathy are also very important for an administrator rather than just looking at the targets and the efficiency and the costing. So that is how I also changed through 3 years by working with him. All the best to you, sir. And we miss you a lot. We were a very great team together. Thank you, sir.
Thank you so much, sir. Can we have Dr. Puneet Khanna on the dais now? And can we please have the mic? Hello, sir. Good evening.
Good evening. It's a privilege to be here. And I think I am the fortunate one who has been with him since 2006, I think, but on the other side of the table. I was his anesthetist for good 18 years, I suppose, 16 to 17 years. And the best part was, I've never seen a better clinician more than him. One of the finest surgeons that I have come across in my life. Other thing was, we always used to be together on Mondays. I have been doing his OT since 10 years. Every Monday we used to be there. And you will be amazed that he used to operate nil per oral for the whole day. It used to be his fast. हम सब OT करते थे, खाना खाते थे, चाय पीते थे, ऐश करते थे. ये बंदा कुछ नहीं खाता था पूरे दिन. शाम को जब OT खत्म होती थी, his mother used to send that kheer. We used to enjoy a lot. And we have very fond memories of that, sir. वो शाम को OT खत्म होने के बाद हमने वो एक खीर खानी, जरा सी जितनी खीर आती थी, वो भी सब में distribute हो जाती थी. I have very fond memories of him. Best wishes, sir. Keep your blessings with us.
Thank you so much, sir. Thank you so much. Can we have Dr. Naman Vahal?
Good evening, everyone. It's an honor to be on this stage when we celebrate Professor Malhotra's life and success. I am his student. I was his student at AIIMS. I did my thesis under him, and now I'm working with him in Apollo. I'm Dr. Naman Vahal, and I want to start with the shlok. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara. Guru hi Brahma hai, Guru hi Vishnu hai, Guru hi Shiv hai. He is the creator, preserver, and destroyer. And Professor Malhotra embodies these qualities very well. जब मैंने PG join किया था, तो OT थे 4. Then one day he created 7 OTs, and he creates so many careers from scratch, including mine. And then सर ने एक दिन अवतार लिया ट्रॉमा सेंटर में, वहां पे क्रिएट करी बिल्डिंग्स, ICUs, वेंटिलेटर्स और न जाने क्या क्या कितने OTs. And then as a preserver, he is a preserver of high standards, of high ethics, morals, and of course joint preserving surgeries are his as big forte as our joint replacement surgeries. But is he really a destroyer? Yes, for me, he destroyed my sleep a lot of times. So, अब सर को मिलना बड़ा ही मुश्किल काम है. Just like Lord Vishnu, he decides कि कब सर अपने दर्शन देंगे. अब सिस्टर को आप फोन करो, सर सिस्टर बोलेगी सर सेकंड फ्लोर पे है, and then you reach second floor, सर होंगे फोर्थ फ्लोर पे. It's impossible to chase him, but there is a way. जैसे राम को पाने का तरीका है हनुमान के थ्रू, एंड नरसिम्हा स्वामी को पाने का तरीका है प्रहलाद चरित्रम के थ्रू. सर के आज यहाँ 5 भक्त मौजूद हैं, एंड वी आर एक्सेप्टिंग कैश. अब मिल लिए एक बार सर से तो वरदान क्या मांगोगे, सब कुछ अवेलेबल है। आप सर से लीव चाहते हो, लीव मिलेगी, सिग्नेचर चाहते हो, सिग्नेचर मिलेगा, फेलोशिप्स, नौकरी, मनी, ही गिव्स एवरीथिंग। बट एक शर्त है, भक्ति में कोई कमी नहीं होनी चाहिए, और भक्ति यहाँ पे है पेशेंट केयर। सर के पूछने से पहले सर के पेशेंट के बारे में सब कुछ सर को बताना है, तभी सारे वरदान मिलेंगे। अब हाँ, और एक और बात है, सर को पहले से पता है कि भक्त के मन में क्या चल रहा है। इस बारे में एक चीज बताऊंगा। जब मैं सेकंड ईयर पीजी था, मैं सर के रूम में गया, मैंने नॉक किया, मैंने सिर्फ बोला गुड मॉर्निंग सर, और सर बोलते पूछने आया है कि बताने आया है। मैंने कहा सर क्या, छुट्टी कितनी चाहिए? एंड टू दिस डेट आई डोंट नो हाउ ही न्यू व्हाट्स गोइंग ऑन इन माय हार्ट। बट jokes aside, I would really like to thank him for being there as a guide, as a mentor, and as a guru. And this documentary is a testament to his extraordinary successful life, not just for his patients, but also for us. Thank you, sir, for being there.
Thank you so much, Dr. Wahal. Pun intended, you stitched it really well. Thank you so much. May I now invite on dais Mr. Sarang Juneja.
With me. For everyone that doesn't know me, I'm Sarang. I'm Dr. Rajesh's son-in-law, and I'm not as prepared as the other people were. So, good evening. Dr. Rajesh is a man that has dedicated his life to the service of people, to the service of his field, and none of this for his own personal gain, just for the betterment of society. You want to speak with me? For a doctor of his stature, having an ego would be a very normal, very easy thing to do, but ask any of his patients, ask any of his colleagues, his friends, his students, and he's probably the most humble man they've met, any of them have ever met. He is the most humble man that I've met. Ask any of his students, and they'll tell you that he's a phenomenal mentor, the smartest man they've met, and a role model to all of them. Ask his colleagues, and they will tell you that he's a brilliant, brilliant doctor, probably the most brilliant in his field in the country right now, and hardworking, dedicated, and disciplined. Ask his patients, and they'll tell you that he's the person that's cutting them open, but he's also the person that makes them the most comfortable. That they trust him, that they laugh with him, that he treats them as a friend, shows them that he's a friend even though he's their doctor. Ask his family, and they'll tell you that he's the most loving man that they've met, and he's supportive and caring, and yeah, just a loving man. Ask me, and I'll personally tell you that he's the best father-in-law that I could have asked for. A man I respect, admire, and love. I am grateful for the example that he sets, not only in his professional life, but also in his personal life and his family. So, I would preferably like to have a glass, but I would love to raise a toast to him. To Dr. Rajesh.
Thank you so much. Thank you so much for such warm words. Can you have Rhythm Malhotra now on the dais, please? And can we please have the mic? Over to you.
Good evening, everyone. It's a privilege to be here, and before I start with my speech, I must say I'm very proud. I cannot have asked for anything but what we saw today. So standing here today to speak about my chachu, Dr. Rajesh Malhotra, feels like trying to capture an ocean in a bottle. His presence in our lives has been constant as sunrise, yet his impact seems deeper and it cannot be put in words. The world knows him as a pioneer orthopedician and the visionary who got the bone bank in India. But we know him as a person who shows up before anyone asks, who stays longer than anyone can imagine, and who gives more than anyone can expect. In a world that celebrates achievements, Chachu's brilliance lies in quiet dedication, treating each patient not as a case, but a beloved family member to someone. What makes him extraordinary isn't just his surgical precision or the medical innovation that he brings in, but the humanity he brings in to everything that he touches. He moves through life with a combination of excellence and humility. And I think we all spoke about his very strong presence with the spiritual side that he brings in. And I think that really grounds the whole of the family that stands together here today. He also shows that the true impact does not need a spotlight, but really just needs a purpose. The film, White Coat Legends, captures something remarkable. The story of a man who transformed. Countless lives, not just his patients, but also his family. By asking a simple question every day, how can I make things better than yesterday? It's about someone who saw beyond the limitations of what was and imagined what could be. Chachu, you have shown us that greatness isn't about standing on a pedestal, but lifting others up. Your quiet strength has been our North Star, teaching us that the most profound impact often comes from the most humble hearts. In you, we see a fusion of professional excellence and personal grace, a reminder that it's not just about the goals we achieve, but the lives we touch doing the same. Thank you for being you. Thank you for being a part of this family, and thank you for opening your heart always to us. Thank you.
Wow, beautifully articulated. Thank you so much for that. Can we have Anirudh Khetrapal now on the dais? Hello, good evening. And can we please have the mic?
Respected guests, family, and friends, as I stand before you today, filled with immense gratitude that we are all gathered here to celebrate this great personality, known to me as Moni Mamu, you guys call him Rajesh, I don't know. So, what can I say? I had prepared a speech, but the movie really moved me, so it's going back in the pocket, and I'm going to talk from the heart. तो देखो सीधी बात है, सब बोलते हैं अर्थक्वेक में गए, पेशेंट्स के लिए किया, मेरे लिए तो ये था, जब फोन करो उन्होंने उठाना है, चाहे फोन 5 मिनट का हो या आधे घंटे का मेरा रैंट सेशन, सब सुनना है और सुन के सोल्यूशन देना, 2 लाइन बोलेंगे और उसमें सारा सोल्यूशन आ जाएगा। और फिर मेरे को लगेगा यार तू पागल है क्या सोच रहा था, ये चीज हो जाएगी ऐसे। Now, I could have stood here and talked to you about his contribution in orthopedic trauma or sports. बट सच बोलूं तो मुझे उसके बारे में इतनी नॉलेज है नहीं, उतना पढ़ा हूं नहीं, एमडी की नहीं अभी तक। तो मेरा तो यही है कि मुझे आज तक समझ नहीं आता कि हमारे पास 24 घंटे हैं, आपके पास कितने घंटे हैं दिन में यार? सुबह 5 बजे से लेकर रात को 12 बजे तक भी काम कर लो तो 19 घंटे हुए, उसमें 190 घंटे का काम कैसे कर लेते हो? तो मेरे को तो कई बार ये लगता है कि ये इंसान नहीं है, भगवान कृष्ण है और मैं इनका भांजा अभिमन्यु हूं, तो उसके लिए भी थैंक यू। तो 2 ही चीजें कहूंगा कि थैंक यू फॉर बीइंग पार्ट ऑफ दिस फैमिली एंड अ बिगर थैंक यू टू नानी जिन्होंने आपको पैदा किया सो दैट यू कैन बी अ पार्ट ऑफ दिस फैमिली। एंड आज की डेट में आई एम श्योर ये जो हमने देखा, it was a wonderful thing. इतने महीनों बाद, like Nani left us quite unexpectedly, but this is a joyous occasion, and to see her actually talking, moving, like I'm sure she's seeing this from heaven and she's smiling and giving us all her blessings. Thank you very much.
Thank you so much, Anirudh, for such spontaneous words. Can we have Rashtriya Malhotra now on the dais?
Throughout his illustrious career, my father has demonstrated exceptional skill, precision, and empathy. His patience, trust, and admiration for him are a reflection of his remarkable character. As a son, I've had the privilege of witnessing firsthand his tireless work ethic, his passion for his work, and his kindness towards those in need. He has been an inspiration not only to me, but to our entire family. He has always had one motto: whatever you do, be the best at it. I still carry his old stethoscope around college, beaming with pride that this is my dad's old stethoscope. Dad, thank you so much for being an incredible role model. You are truly a white coat legend.
Thank you so much. And now can we have Dr. Ruchi on dais?
I met him in 1992, and my dad met him before I could meet him, and he had already decided after meeting him, he had this vision that this is the man whom, I should marry. So I was just told that this is what has to be done. He had this vision. He knew this man is going to become very big one day. And I'm sure today his blessings are there with us. And we have been able to reach and see this proud moment. And I'm really lucky, thankful that I have had the privilege to be with this man who's extremely honest, committed, sincere, very loving, very caring. He is so caring to his patients, you can imagine how he would be for his own family. I'm really grateful to the Almighty to have given me this life to share with him. Thank you so much.
Thank you so much, ma'am. I think this evening will be incomplete if we don't invite none other than Dr. Rajesh Malhotra. Can we please give it up for him? All right, sir, over to you, and we are ready. What you had requested.
A very good evening to all of you. I am really indebted to you. I am humbled by your presence. Each one of you occupies a place in my life. You are all very special to me. You are all a part of my life, and I'm really, emotional that so many of you have taken out time on a Sunday evening. I thought I'll take a few more minutes from you. I consider myself very, very lucky, and I always had, the right education, the right friends, right colleagues, and above all, a very, very supportive family, a very loving, affectionate family. So I think for my youngsters who are here, my team, I just want to give you in next couple of minutes what I think is the gist of my life. Sorry. So the first thing, everybody knows that I am a Bhakt of Lord Shiva. All of you know that. But what this very prominent shloka says is that Shiv likes those who do selfless service, those who have compassion, and those who have love. I think all these three services are important for every human being, but more so for a doctor. So that's what we were brought on. When I could barely walk, my mother would give me a glass of milk and say, go to Shivalay and about 8 houses away and jao jal chada ke aao. So that was when before I really started understanding anything even about life or even before going to school. And then we had our own guru like everybody has, and she even after leaving for heaven continues to guide us. This is not a space occupied by anybody else. So we all a trust of highly educated people, run the trust. And then the mother who guided always, who continues to guide, somebody who gave away her life to bring up her children totally selflessly. She was the one motivation, driving force which taught us that you can you can live for others and be extremely happy and satisfied. And the other thing which I like from Shiv Kheda is he says it's only your teachers and your parents who correct your mistakes. The world will punish you for your mistakes. So all those children who have arguments with their parents, I want to tell them that nobody in the world cares for your welfare more than your parents. And of course, one of my teachers used to say that your students and your children are, in his words, your liability. You have to see that they are settled when in life. And then these are some of my remarkable teachers, David Morgan, who taught me bone banking and revisions, Dr. Bhan, Dr. Ranawat. But I think the place of a teacher is really very important in your life. And you tend to, particularly as a surgeon, you tend to just emulate everything which your teacher is doing. And I have been very, very lucky to have brilliant students. So if you want to grow, you should be surrounded by people brighter than you. I think I would hate to be surrounded by, people less intelligent than me, where I appear as very intelligent. I think that would be my downfall. So I think I've had students, all of them are more brilliant, more hardworking for me, and I'm very, very proud of them. And I've been very lucky to have such great students with me. And then, of course, the lady who made maximum sacrifice. So we have had couples, even in names, the power couples where husband and wife both did very well professionally. But here, my wife gave up her career, her profession to bring up the children. You can imagine if I am leaving at 6 o'clock or 5:30 or 6:30 in the morning, the children have to be left to the bus stop. They have to be picked up from the school bus. They have to be fed. Their education, their books, everything has to be done. And that's what she continued to do. It's like, the wall at the other end, the cricketer who makes sure that one end is secure while you can keep on scoring runs at the other end. She is that Rahul Dravid of my family who secured one end so that I could achieve that I could. And I think the credit for that goes more to her than to me. And then, of course, the beautiful family which came along, and I'm really proud of my family. And this is it's really, I think family is above everything else which you can have. And I've been very lucky by grace of God to have a loving family. And then came the extended family, and I got in my extended family people who are like even more loving than my own real blood relations. So God, again, in more than one way, I think has been very kind to us. And then the team, the people who work. And then I have had a chance to build teams time and again. So there was a team, I left. So people said, how will you practice? So I said, where's the problem? We can always make another team. And then the more teams you make, the more people you train, the more expertise goes out in the society. And then people who get trained by my students, I can say, are actually very, very privileged, more privileged than my own patients. I think my students are a matter of pride for me. And then, of course, some of very close friends, which I'm again very lucky to have. Some of them are here. I'm very happy and grateful that I've got great colleagues, great friends, great family. But I think last few lines about professionalism, we all know that it is on 4 pillars of excellence, humanity, accountability, and altruism, on the foundation of ethical and legal understanding, communication skill, and the competence, which is the very base. And then, of course, the professional health and wellness is there. This is surrounded. This is followed by the fact that you can excel as a professional only if you enjoy your work. You have a pride about what you do. The motivation actually means the joy and pride in the work and self-imposed standards. I always say If you achieve something, set the bar higher. Don't stay there. Don't dwell on this. Move on. Push the envelope further. I think that's what my students also love about me. Once we achieve 100%, they say, okay, let's see how we can go to 110%. And if you are not really in the right profession, if you don't enjoy what you are doing. And some of this rhythm said we didn't plan it together. But excellence is when you care more than others think is wise, risk more than others think is safe, dream more than others think is practical, and expect more than others think is possible. And of course, the medicine is a lifelong learning profession. And this is what Naman also said. This is the Kaizen principle, which says that every day you have to improve yourself, even if it is only by 1%. So I always say that also comes to your personality and thinking. I always say a man who thinks at 60 years of age the way he used to think at 30 years of age has wasted 30 years of his life. The solutions change as you mature and as you learn more about life. And then you have to be a leader. Everybody has to be a leader, either at home or at profession, wherever. And I think as a leader, you create more leaders. That's true leadership. And then, of course, we all talk about work-life balance, although I myself am not great at it, but then it doesn't. So my father used to say, even if you are not doing the right thing, you are, obligated to teach your children the right thing. So I tell everybody, all my students, that's why I don't deny them leave. I let them go. I tell them, have fun. They will tell me, sir, I'm going to US tomorrow morning. So I said, very nice. You could get visa overnight and the ticket and everything, but go ahead, enjoy your trip. But then we have this tendency to, have a career encroaching upon the space, the margin, out of proportion, which I think something which is really not advisable, even if I do it, because I have a younger sister here who always tells me, self-care is not selfishness. You can't serve from an empty jug. You can't serve the world if you don't look after yourself. And I think self-care is extremely important. All of you know about the important tenets of self-care. But then I think the last thing which I want to tell is that, the more mature you are, the more you will know how to react to criticism, because this is what we say, isn't it? One of my very close students, friend, maybe my mentor, Colonel Satish, he will often say that, that Nindak niyare rakhi angan kuti chwai, bin pani sabun bina nirmal kare subhai. So no problem. Let people criticize you. If it is destructive criticism, it doesn't matter. If it is constructive, it means there's something for you to change, which means you need to improve, and why not? And then, of course, always support, whether it's a family or your colleague or your students, support those who support you. And then, of course, every one of us has someone looking at him, looking up to him, and it's our duty. And the last of all, I want to thank this incredible team with which we worked for a few days, but we realized how hardworking they are. If you don't see, you see that man there, behind that man, I could see when I worked with him. When you're a professional, you are inspired by other people who are professionally excellent. Whenever I see a successful man, I don't feel jealous. I want to know what are the qualities which have made him so successful. And I think if we can emulate some of them, I have learned so much from you, Chintamani, and also from Tanuj and Tanuka. I'm really grateful for this movie, and I'm grateful once again to all of you to have come here this evening on a Sunday evening to take time away from your routine to come and really have participate in this celebration with us. Thank you very much once again.
Thank you so much, sir. Thank you so much for sharing your mind space with us. May I now invite on the dais Mr. Prince Uppal for the vote of thanks. And if we can have the mic also, please.
Very good evening, everyone. On behalf of Mankind Pharma, it's a privilege to deliver vote of thanks on this special occasion. A moment to celebrate inspiring and visionary journey of Dr. Rajesh Malhotra, sir. First and foremost, heartiest gratitude to you, sir. Your journey has been truly inspiring, full of warmth, dedication, touching millions of lives and spreading happiness. Thank you from the core for giving us a moment to make you feel happy today. Thank you. Special admiration and gratitude to all the family members for being here and making this event really awesome. Thank you. Thank you to all the audience, esteemed doctors, for their gracious presence. Your enthusiasm, your participation reflects your admiration and respect for Dr. Rajesh Malhotra, sir. Thank you once again. At this moment, I would also like to thank Team Mankind for wonderful conceptualization and special mention of digital team for seamless execution, meticulous planning and seamless execution of this great event. This means a lot. As we conclude this event, let us take the learning from illustrious journey of Dr. Malhotra and try to imbibe these learnings to make our path to move towards excellence in our own field of work. Thank you once again for your presence. Let's join us for dinner. Thank you.
Thank you so much, ladies and gentlemen. You have been a great audience. Please enjoy your dinner.